Good evening. My name is Joel. I'm not a Democrat.
Not a Republican.
I'm not a Republican. I'm not a Libertarian. I'm an American.
That's right.
As my wife will tell you, I generally piss everybody off. So. Hey, Mr. Kokkonen, can I ask you, what is you're running for the House of Representatives? Is that correct?
I'm not here on any political mission at all.
But are you running for the House of
So I
Representatives?
won't talk about anything
Okay.
like that. Thank you for asking.
Okay. Right now, and I'm going to get to healthcare. Right now, to run for the Senate, the average senatorial candidate spends $8.5 million to run for that office. Okay? There was a gentleman who spoke to this earlier. It's the #1 problem. You want to know why we have healthcare problems? It's because the pharmaceuticals and the big companies own the politicians. All there is to this. I have another question for people. Is the United States a republic? Raise your hand. Is the United States a democracy? Okay. The United States is a republic. The duty of a public representative in a republic is that they not represent the majority, but they represent the better of that community. That means that the people who are uninsured deserve representation, and our nation was set up for that. I'm not here to tell you how to do it. I'm just telling you that that is a fundamental way our nation was set up. And if you forget that, you're not right, you're not fair to our nation. The next question I have is, the statement is 99% of the people over 65 in this country are insured by Medicare, okay? If you're in the age of roughly 24 to 36 years old, only about 66% of those people are insured, all right? Now, I don't think it's necessarily the right answer, but a gentleman made a point about allowing other people to enter Medicare. I don't necessarily think that's right. But if you're 65 years old and you want Medicare for you and it's not okay for them, you're a hypocrite. And you're not willing to do what needs to be done to get their representation. You need to help these younger people figure out how to get what you've got, because they deserve it. One last thing. You don't get Medicare, or you don't get health coverage just because you work. It just doesn't work that way. I'll leave you with a last quote. It comes from a song by a guy named Ian Anderson from Jethro Tull. And it says, "The doer and the thinker, no allowance for the other, as the failing light illuminates the mercenary's creed." What it means is the Republican and the Democrat who don't allow for the other are illuminating the light for the mercenaries, and you're doing damage to our country. We're supposed to work together.
Hello, my name is Barry Cohen. I have mostly questions for myself. And one is, if this is such a great thing that the government wants to do for us, why are they all opting out for themselves? Another thing is, someone just said the military was socialistic. Well, it's not. I've been in it. It's a dictatorship. That's probably one of the few functions that the federal government does correctly. So I'm going to just say this, what I've learned in my life is the government's not the answer to a problem. They are the problem. It's up to us to take care of it. Tells the government to leave us alone. Basically, they don't give the government rights to do things. They allow us the rights. And the government's supposed to protect the people so the people can do what they do. And capitalism is what made this country so great.
Last night in the middle of the night, I awoke and I had a thought. And the thought was, I hear when I listen to talk radio at times, people say if there's a public option, it will drive private industry out of business because, of course, everybody will pick the public. There's a school up north called Stanford, private institution. There's another school up north called Cal, a public institution. They are both fine, wonderful institutions, and people are fighting to get into both of them. The public option of Cal has not destroyed Stanford. The public option of UCLA has not destroyed USC. And those of us who live in this town, I was lucky enough to go to Cal Poly and get a teaching credential. Thank God there was a public option where I could go to a public college at an affordable price so that I could work and have insurance. Now I want to talk briefly about insurance. I hurt myself playing racquetball about 3 months ago. I have Blue Shield. I have a wonderful plan. And I have a sciatic problem. I used to walk an hour to an hour and a half about 5 days a week. I can now walk maybe 3 blocks without being in pain. Blue Shield at first said, no, you cannot have an MRI. Then when I went to a doctor who wrote a further report, I was told again, we need more reasons to see why you have an MRI. What medications are you taking? What therapies have you had? It has been 4 months, and I got another letter today saying, we're very sorry. So those of you who are saying, well, the public health plan is working, I haven't been able to exercise the way I want to for months because private insurance, Blue Shield, that some of you are supporting so much, has not allowed me to get any help that I need, including acupuncture, which a lot of people have recently said works. My plan doesn't cover it. It is a wonderful idea to save taxes. It is a wonderful idea to do what some of you were talking about and not take away your private health insurance. I'm not trying to take it away. Just as people aren't trying to take away the right to go to Stanford or SC, I'm trying to give people options.
Two, three. Wonderful. We might make it exactly. Thank you.
I'm like that little young lady that needed to hold the thing and not faint. My name is Nancy. I'm from Cambria. I've lived there for 15 years. Number one, I'm a little bit sick and tired of being demonized because I don't believe in the Obama health care plan and saying that because we don't believe in this non-planned plan that we don't somehow care about our fellow Americans and all human beings. My father was a veteran of World War II. I'm a member of the American Legion Auxiliary. I volunteer on a regular basis. This is not a plan for health care. This is a plan to grow government. I'm an Italian-German descent. I'm an American, born here. My father was the first in his family born here. All of our relatives had to come here legally. They had to have sponsors. And none of them ever expected a damn thing from the government. We all are here to help one another, and we can help one another on a regular basis, and we do. And we don't need President Obama or the Congress to tell us how to do it. My mother was 9 years old when Hitler invaded Germany. She lived in Germany. My uncle is still in Germany. My uncle's waiting for heart surgery. He may die trying to get it because he's over 70 years old and he's already had 2 surgeries with stents. The stents aren't working, and his great socialized, nationalized, whatever you want to call it, healthcare is probably going to kill him because he has to wait in line.